created this information video as a guide so you understand what to expect in the lead up to your surgery. Your surgeon will have informed you that you're on the waiting list for elective surgery at the Fitzwilliam Hospital. Whilst you're waiting for surgery, it's a great opportunity to prepare yourself and ensure that you are as healthy as possible. You can do this by ensuring you attend reviews with your GP. If you have a long-term condition such as diabetes or COPD, then please ensure you have had a medication review and any recent blood tests. This will help us to ensure that you are fit to proceed. The next step is that you'll be contacted by a member of the bookings team to give you a date for your procedure. Once you have a date, you'll be invited to attend one of the pre-operative assessment clinics. During your pre-assessment, you'll be reviewed by one of the specialist pre-assessment nurses. You'll be asked questions about your general health, medical history, and any current medications. We will then perform any required tests, which usually include blood tests, MRSA swabs, and an ECG, which is a tracing of your heart. It is sometimes necessary for us to organise an anaesthetic review as part of your pre-assessment, which may result in you needing more specialist investigations. This is nothing to worry about. It is also important, if you've been listed for either a hip, knee or spinal procedure, that you complete something called a patient reportable outcome, and also it's important that you complete a National Joint Registry form. Spinal consent is also something that will be discussed with you separately.
My name is Jose Blanco. I have worked at the Fitzwilliam Hospital for 4 years and I'm an orthopedic surgeon specialising in hip and knee replacements. Here at the Fitzwilliam, we've invested a lot in our enhanced recovery programs. We're really trying to get people to recover as soon as possible because that has the most benefit, both in terms of minimising how much we medicalise their condition, but also reducing the risks of infection and blood clots and all of those things. If the pain is causing an impact on your quality of life, such as avoiding going out or avoiding situations that you know are going to cause you pain, then you're making life decisions based on the pain, and I think that really should be quite a sensitive marker of when you should be considering something more definitive.
Prior to admission, you would probably have been taking regular pain relief, and we recognise that there may be concerns about pain management during your hospital stay. Our commitment in pharmacy is to reassess your needs after surgery and provide a personalised analgesic regime. Our commitment is to always prioritise your pain management to ensure a smooth and supported recovery process.
I'm Rupert Clifton. I'm a consultant orthopedic knee surgeon at Ramsey, Fitzwilliam and Boston West hospitals. I've been working here now for the last 13 years, exclusively doing knee surgery. Most patients will end up having something called a total knee replacement, where we replace the entire joint in the knee. However, some patients, particularly with early arthritis that just affects one part of the joint, such as on the inside or the kneecap joint, might have a partial knee replacement, sometimes known as a unicompartmental knee replacement.
The best way of improving your outcome after surgery is to be as optimised as you can beforehand. And that will involve things like making sure that we've avoided smoking, which reduces our risk of infection, and that we have a good healthy diet beforehand, which will improve the ability to heal. Some of the anaesthetic issues around the surgery is important, and we really push towards spinal anaesthetics, and that really tends to help. And being as active as you possibly can beforehand.
So the incision for the operation is as long as it needs to be. Generally, it will be smaller for a partial knee replacement than a total knee replacement. We do try and keep the incision down to a minimum, but of course we have to make it as safe as possible. During your operation, you will come into the anaesthetic room and meet your anaesthetist. They will then carry out the anaesthetic, and once this has been done safely, you'll be moved into the operating theatre. Here the surgeon will prepare your leg in a sterile technique and drape everything. We'll put up a little tent so you won't be able to see anything of the surgery. Once we start the surgery, we open up the knee and remove the arthritic joint. Using quite complex jigs and instrumentation, we then put in a joint replacement very accurately to realign your leg. Following the surgery, you'll go to the recovery area for approximately an hour while we get over the surgery and check everything is okay. You'll then be transferred back to the ward for your recovery and physiotherapy. You will have painkillers after the surgery, and the physiotherapist will encourage you to move as much as you can.
The first step is preparing for your surgery. This helps increase the success, as well as having an effective rehabilitation process. It is very important to do your pre-op exercises. Pre-operatively, you will be contacted by the physio team who will go through information, as well as discuss the enhanced recovery pathway, which focuses on getting you home after a 1 or 2 night stay in hospital. This improves clinical outcomes and reduces post-operative complications such as infections. Post-operatively, it is important to complete your physiotherapy exercises, which you will be shown. These are essential for an effective rehabilitation process.